It should be on. Everybody hear me okay? Thank you for coming. Today we'll get started. We've got about an hour presentation. The title of it is Loyalty, Beyond Patient Satisfaction. I'm going to be presenting along with a couple of cohorts. I'm Jeff Rydburg. I'm with HCA Physician Services. I've been in healthcare for about 30 years. I'm actually a recovering CPA. Don't hold that against me. Been in practice management in independent groups and hospital-sponsored groups. HCA has about 3,000 employed physicians through a series of organizations, about 7.5 million visits a year, $1.2 billion. So we're a fairly large but very spread out organization. We have 675 sites. So you take 3,000 doctors divided by 675 sites, and you find out that our mean site may only be 4 or 5 physicians. So with me today, I've got Jerry Stone. Jerry Stone is with MedicalGPS, co-founder. MedicalGPS is the patient satisfaction firm that we use. Jerry has 35 years of experience working with organizations on patient satisfaction kinds of issues, service issues. He spent 20 years or so in healthcare and about 15 years with American Airlines. All of us who flew out here know there's never any problems with airlines that would require any service recovery. Also with me is Dr. Garrison. Dr. Garrison is an associate professor at Belmont University in their School of Business in Nashville. Gary allows me, better way to word it, to guest lecture at his MBA courses in Nashville. And this course today is a little bit of a brainchild of our collaboration, okay? So with that, let the journey begin. Patient satisfaction. You'll notice that satisfaction is kind of in the middle, okay? I believe that patients, for the most part, are satisfied with their health care. They may not be all that satisfied with the insurance part, trying to understand it, but they're fairly knowledgeable about whether they like their doctor, like their practice. Our point today is going to be satisfied ain't good enough. Satisfied is like average, okay? And you don't want to aspire to average. What you want to aspire to is loyalty. And there's 2 kinds of loyalty that we'll explain. Retained loyalty, meaning the patient will keep coming to see you. And then advocacy loyalty, which is what you all should be shooting for. That's where patients will go out and tell other people about you. That's what you want, okay? So, again, keeping everybody awake, show of hands. How many of you are not doing any formal patient satisfaction survey process in your practice? A few, okay. How many of you are using a paper process, either little 3x5 cards that they fill out and drop in a box, or that you mail something to them? Okay, a number of you. How many are using a Press-Ganey type telephone calling system? Okay. How many of you are using an electronic method, which is what we use, and we'll talk about a little bit here. Okay, so the vast majority are using electronic method. Almost everybody is doing something. So everybody obviously understands that this must be an important topic, okay? So loyalty. Why loyalty, Jeff? Well, it's a little after lunch, but I'm still hungry. Let's talk about pizza, okay? So I like Domino's pizza. Eat it, like it, pepperoni's great, good service, so I am satisfied with my pizza. It's Friday night, it's been a long week. I get home, I'm looking forward to my Domino's pizza because I'm a satisfied customer, right? And I get home and I say, honey, we're going to order pizza tonight. And she says, great, good news. I just got a coupon 50% off at Pizza Hut. Oh, okay. Well, you know, I'm satisfied. I like my Domino's pizza. But if I'm not loyal, what do? I follow the coupon, right? 50% off. I'm going to do that. Does that apply to healthcare? Yeah, especially primary care, okay? How many of you in your primary care networks or in your markets have urgent care centers or walk-in centers or Walgreens or Walmart or anybody, take care clinics, minute clinics, all of those kinds of things? Most of us have that competition, okay? So the point is a satisfied patient will come and see us. as long as we have an appointment time that's convenient to them, as long as when they call at 7 o'clock at night, somebody answers the phone, thinking that may not be a lot of us, right? As long as we don't do something that makes them unhappy when they're there at a visit. If the doctor was late and they had to wait 45 minutes, if they're satisfied, that tip from satisfied to unhappy is pretty close, right? But if they're loyal, they overlook those little things like the doctor's running late, I had to wait a couple minutes on hold. They will wait for you to come back, okay? The learning objectives for today, obviously, why should we move beyond mere satisfaction to loyalty? Some of the differences between satisfied and loyal patients. We're going to talk about the drivers and specifically the components of an office visit that are most correlated with how people feel about loyalty. And then finally, what can we do to increase the loyalty of our patients? Okay? So why do we care about it? First, obvious, right, is patient retention. That's retention loyalty. If patients are loyal, then they will come back. They will come back and see us, even though they may have to wait a little bit, even though the parking may not be all that good, even though, you know, the nurse maybe didn't write something down correctly last time. If you have loyalty, they overlook that. Second, new patient growth. If you're at advocacy loyalty, what does that mean? That means your patients are telling people about you. A satisfied patient doesn't go out of their way to tell people about your practice. If somebody asks them, they might tell them, okay? But an advocate does. And what's really cool, if you guys have been going to the different sessions, is you know that social media has completely changed advocacy, right? It used to be, I don't know how many of you are old enough, maybe just me, to remember a Prel commercial from, I don't know, 30 years ago or 40 years ago or something. And it was, if you tell someone and then the screen split, they tell someone and then the screen splits again and they tell someone and so on and so on. The point is, if you have an advocate 10 years ago, they might tell their neighbor, they might tell, you know, a friend on the golf course, the tennis court, the supermarket. Today, if they're advocates, those people can go online and let thousands of people know immediately if you're a good practice to go to. If people are asking questions, they will go out of their way to tell people about how good you are. That gets to reputation, right? If there's enough people speaking positively about you, you get a positive reputation. People who don't even know your practice all of a sudden are advocates because, well, you're the clinic. Everybody knows that clinic is great, right? And finally, reimbursement. How many of you are familiar with CG-CAHPS on the hospital side, right? Hospitals are getting reimbursed today based on patient satisfaction scores as part of the CG-CAHPS. How many of you are familiar with CG-CAHPS? Right? Some of you. CG-CAHPS is exactly the same thing on the practice side. It has not been implemented yet in terms of compensation. It has been implemented in terms of data collection. We submit, many of you may submit already, information to CMS on patient satisfaction so that you can measure yourself across the country. Even though it's not required today, why do we do it? We do it because we don't want to wait until it impacts our reimbursement to learn how that system works. We want to know and prepare today so that when they say, okay, we're starting it in 2016 and it's going to be 5%, 3% of your reimbursement, we want to know how the game's played. We want to know the rules and we want to make sure that we win on that. How does it impact your practice? First and foremost, it's better quality. Why? Because loyal patients listen to their doctors. They follow the advice of their physicians. If you're merely satisfied, you know, yeah, I'm feeling better. I don't really need to get that other test the doctor asked me to get, or I'll take that medicine for 2 or 3 days and I feel better. I don't need to keep taking it, right? Higher volume, as we talked about, those patients come back. Many of you are losing patients, just like we are, to urgent care centers, et cetera, on weekends, on evenings, okay? Loyal patients come back. Higher volume through referrals. They're advocates. They're telling people about you. They're going out and telling other people that you're the right place to go to, which leads to reduced marketing costs. You don't have to spend a marketing dollar. Who's your marketing team? Your loyal patients, right? Just think how much money you can save if your loyal patients are out there telling everybody about how good you are. I looked up this study from the Associated Press, trying to think, how do patients measure quality in an outpatient practice? I don't know about you, but I know we have a hard enough time trying to figure out how to measure quality in an outpatient practice. Imagine for a patient or a non-clinician how hard that must be, right? So Associated Press and the Center for Public Affairs Research did a study, and these are the attributes that they identified through this survey that patients identify as quality, okay? So first, physicians listen and concerned or caring, that the doctor is listening to them, the doctor cares about them, okay? Personality traits, the doctor looks them in the eye, the doctor is easy to talk to, those kinds of things. Those are the primary traits or attributes that identified with quality. Secondary, the knowledge, experience, and education. How long has the doctor been practicing? What medical school did they go to? Do they have advanced degrees? Those are secondary. Tertiary, meaning still important, but near the bottom of that scale is medical philosophy. Affordability, meaning people will pay copays to see the doctor they want to see, or pay a higher copay sometimes. Or the office environment, the telephones, the parking, the signage, all of that stuff, though important to quality, the patients understand that isn't really what quality is all about. So what we're going to talk about today is a little bit on how well does that line up with loyalty. And the answer is almost identical. Okay? So how does it impact your practice? Whoa, I think I pressed the wrong button. So I built this, what I call loyalty curve. Okay? How many of you think your patients are satisfied with your practice? Okay, I would think almost everybody. Why? Because of the red line. Okay? In order to have a satisfied patient, you pretty much just have to do the basics right. I don't know if that's because we do that good a job or if it's because patients assume such a low level of performance is okay with them. A little bit like airlines probably, right? As long as you got me there, I'm good with everything else, right? The loyalty curve on the bottom is different though. The loyalty curve takes a long time to build up. The loyalty curve takes success in a number of factors to build up to loyalty. It's not something that just happens, okay? So you can have a whole bunch of patients that are satisfied very quickly in your practice, but that doesn't mean they're loyal. So most patients are satisfied in our organization. About 75% give us a top box score if you're familiar with that. So we have a 5-point scale, so that means they're giving us a 5, okay? The top score that they can give us, that was a top box means. But are they loyal? I don't know. So that's why I went to my friend Gary and Jerry and said, let's do a study. Let's actually study the different components of care and figure out which ones impact patients' loyalty the most, okay? So Gary is going to talk about what we found. Do you need that? You're running up there?
They didn't give me a portable mic, so I got to go hang out behind this thing. All right, so my role was the data analytics. Is this on? Or should I just scream? The IT person can't even turn this on. Well, maybe that's not the button. All right, can everybody hear me? Just fine? All right, so again, my role was the data analytics. I see a couple people out there yawning, which makes me feel like I'm back in the classroom, but that's okay. All right, let me explain kind of the process and then tell you what the data told us. MedicalGPS put the survey together for us, and then they captured the data as well. And how they did that, they did a kind of a two-step process. One, when a patient was finished with the visit, they could respond to the survey using a kiosk located in the clinic. Or they received an email within 24 hours of the visit. That email had a link embedded, which took them to the online survey. So we analyzed 16,000 responses that covered 1,600 different providers, with varying different specialties. Okay, so we've got a really good sample size. All right, so the patients, they answered questions based on what they call a 5-point Likert type scale. Here's where I start to bore you, where it's a 1, strongly disagree with a statement they were asked for that question, to 5, strongly agree. All right, and then 3 was a neutral point. And then the analysis, we wanted to see not only is, but how much is patient satisfaction correlated to loyalty? Does it matter? And we're going to find out the answer in just a second. So we're going to talk about kind of the overview of the major findings, then we're going to drill down a little bit. All right, so the biggest impact or biggest correlators was that interaction with the provider. All right, was the exam thorough? Did they show courtesy? Were they showing concern? Did they answer the questions? All right, then we also looked not just at the correlation, but in terms of, we looked at loyalty. Those that said they're loyal on a scale of 1 to 5, so we looked at the 5s. Those 4s, 3s, 2s, and 1s, we put them in a different pile. And we said, is there a difference in satisfaction along those points of engagement or those components of the visit process? And yes, we found similar results with the interaction with the provider, but there's also big gaps within the differences in how frequent, or not frequent, but the gap between when the voice message was left by the patient and when the provider responded. And then was the wait reasonable from when the time they walked in to that clinic to the time they walked out? Was that gap, were they satisfied with that gap as well? Before we talk about loyalty, I'm going to define it. 2 types of loyalty we looked at. One was retention loyalty, as Jeff mentioned, and the other was the advocacy loyalty. So here are the 2 definitions, and you all should have that on a handout, at least the questions for each of these engagement points or components, and then we'll talk about it a little bit more in a minute. Retention loyalty represents a patient's willingness to continue to seek medical services from the same provider or from the same practice. All right? Then what we really were concerned about is the advocacy loyalty. All right? What is the likelihood a patient is going to recommend that medical service or provider to his family, to his friends, or his or her friends? And there are the 2 questions we asked for retention loyalty. How likely will you continue to seek medical attention at your practice? I believe this practice has earned my loyalty. All right, both of these we're not going to talk about reliability and validity, but the survey instrument has been tested and has met the acceptable levels of reliability and validity in the social research spectrum. And then advocacy loyalty. I would recommend this practice to my family and friends. And if I was going to come back, or if I was going to seek similar, if I was going to select a similar provider for the first time, how likely am I going to choose this exact provider? So are you going to advocate for yourself as well? All right, so here's where it gets fun. All right, so the first statistical technique we looked at is called structural equation modeling, which looks at the strength and the direction of the relationship between variables. In this case, we looked at patient satisfaction, retention loyalty, and advocacy loyalty. What the model told us, or what the data told us, is you can't have advocacy loyalty without having a satisfied patient and having a patient willing to come back to your practice. And how do we know that? Well, at the very top, I can circle it. Up here, above the arrows, is what they call the path coefficients. All right, path coefficients just says, and it's based on a scale of -1 all the way to a +1. So if there's a negative correlation, then you would have a negative value. But it's a positive correlation, meaning if patient satisfaction increases by 1 standard deviation from the mean, then the retention loyalty is going to increase as well, but not by a full amount, but by 0.77. From social science research standards, that is a very strong path coefficient. But then you look at the 2 variables together, does that lead to advocacy loyalty? Again, as they rise, your advocacy loyalty rises as well. And we're going to talk in a minute about how can we get it to rise. Then we look at the R-squared values in the little circles. And this is basically tells you how much of the variance of our survey captured what it means to have retention loyalty and advocacy loyalty. When you're dealing with human subjects, it's nearly impossible to get a perfect score of 1. But what we have here is we captured 76, almost 77% of all the items or all the questions asked. We captured 77% of the things that make someone report as being an advocate of our practice. What are the other variables out there? We don't know. Could be trust. Trust your provider. Trust the examination. Could be other things like the type of care. Maybe it's acute care versus chronic care or so on. So there's more research that's needed, but the bulk of this relationship here captures what makes someone an advocate. All right, this is probably going to be tough to see, but here we looked at the different correlation coefficients for each of the components of the process of that visit, starting from when the phone was first answered, when the patient made a phone call, all the way to when they received their invoice. All right? How loyal, or what sort of correlation do we have with loyalty? And we broke out the two different loyalties. Blue is retention loyalty, and green is advocacy loyalty. And what you can see here, the highest correlation, the closest we can get to a perfect score saying, yes, satisfaction 100% equals loyalty, we have this right here, the interaction with the provider. Okay, and we'll talk about the numbers in just a minute. They're on the back of your hand sheet or handout, or it could be the front, however you look at it. But not only is that important, the interaction, look over here at the very last one, this overall satisfaction. So it's not just determined by your interaction with the provider. There are other points of engagement that are important to determining whether or not you're going to be an advocate for your practice. So let's take a look at that. So this table does that for us. All right, so for social science research, if we have a value of a 0.6 all the way to a 1, that is a high correlation. All right, so the higher the better of the number. And then this green, the darker green, from about a 0.5 to a 0.59, that's a moderately high. So we're looking, notice here that we have the questions, or I guess the abbreviations of the questions listed here on the left-hand side, the two types of loyalty. What you should notice here is it takes more effort to get to advocacy loyalty. Just by looking at the green and the blue values, all right, here, just the top two, because these are very important in terms of correlation, there's a lot more going on to get to the advocacy loyalty than it does the retention loyalty. Then over here, we ranked in order of the highest correlation to the lowest correlation, and you can see here that is pretty much the interaction with the provider. That's the most important. All right, so then the next thing we did was we looked at those that responded to a 5 on loyalty. We put them in their own group. We took everybody else. You could argue that maybe a 4 if they respond with a 4, that, yeah, they could be considered a loyal. But we said 5, you're loyal. We took everybody else, and we put them in their own pile. Then we said, where is the difference in satisfaction ratings between each of those components? All right, where is the gap? What's the largest gap? Because that's what we want to do. We want to close that gap to create a loyal patient. Not just any loyal, but an advocate. So here, the next couple of slides is going to talk about the biggest gaps in satisfaction. Notice here at 2.05, so if 5's the highest on satisfaction, we came pretty close with the exam was being thorough. But down here, if we can get to it, over here in the red, the exam thorough for those that are not loyal, there's a 2-point gap in satisfaction. All right. Again, some of the 4s will elevate that up. So if we took the 4s out, you would see that number drop even more significantly. But what surprised me was the next two values, provider concern and provider answers, they weren't the second biggest gap. It was the fact that my message wasn't returned in time. All right. Or I didn't feel satisfied with the time gap. All right. So what that is saying is if I'm concerned enough to call the doctor, all right, I need a response. It kind of lowers that anxiety level to increase the satisfaction score. The exam being thorough, yes, if I'm going to schedule an appointment, come to the office, wait however many minutes or hours to get to see that doctor, I want to make sure I got my money's worth. I want to make sure that they were respectful, they were courteous, they took the time to give it a thorough exam, and the treatment was thorough as well. So these are important factors in creating an advocate. And then really the next level was how was the phone handled? But even more to that, let's go to the very end of that visit. The invoice. Did you get it right? All right, they want to make sure that you're not overcharging them or they're paying for what they got. And then the billing office. If there is a discrepancy, that billing manager or whoever's taking care of the billing, they've got to be courteous. They've got to be respectful. They've got to be able to resolve in a satisfactory manner to get to that advocacy loyalty. All right? So to sum up kind of the data, you've got to close the gap, all right? Overall satisfaction is key to starting that journey to getting an advocate as your patients, all right? So we're going to focus on closing on the gap on the most influential components. And here's where kind of the dessert of the presentation comes in, because Jerry from MedicalGPS has got 10 action items that will get you from a satisfied or merely satisfied patient to an advocate, someone who is going to go out and say, this is where you need to go for that medical practice or service. So Jerry, I'll turn it over to you.
Thank you, Gary, and thank you everyone for the opportunity to be here today. We'd like to cover these 10 action items for you and offer them for your consideration. Each of these items have been deployed and are active in an organization that we're going to talk about today, and that organization has used all of these for the last 5 years to affect positive change inside their practices. We'll have some data for you from that actual organization to show you some of their improvement, and we'll also have some slides for you as we go through. So the first thing you do, you ask the patients for their feedback. It seems like an obvious thing to do, but there's sometimes folks that don't do that. And how often do you do that? You do it as often as you can. We'll talk about that in a moment. Coach and counsel. As you get feedback back from your patients, use that information to coach and counsel with your staff, including your providers. Do it in a timely way. Do it soon after the visit. In the model that Jeff talked about, he is surveying the patient the day after their visit and taking that information and affecting change soon after, within days of the visit. Investigate any service failures. So if you've got something that didn't go right, investigate that, research it, and follow up on it as soon as you can. Overcome opinion with objective data. We'll talk about what that might mean here in a moment. Nourish a culture of service excellence. You guys have heard some form of that talked about in perhaps every session you've been to. Certainly the keynote speakers have talked about that. Act. If you collect data, that's one thing. To have the data and to do nothing with it, it's not going to be very effective. So act on the data that you bring back. Brag on your superstars. As you collect this data, your patients are going, for the most part, tell you how wonderful your staff are. They really are. Don't miss the opportunity to use that information to congratulate your staff for a job well done. It's probably going to be what you're doing about 90 or 80% of the time if you're the frontline person. Listen, look, and learn. Leverage technology to do that. Many of you raised your hand. You're using electronic means to gather information. You're leveraging technology to listen to your patients. And then last, encourage, empower, and expect excellence. So let's talk about asking patients. What does that mean? This was a Harvard Business Review study. Pull this down. As you guys download the takeaway document, you'll notice that we have hyperlinks here at the bottom for you. If the PDF has an active hyperlink, you should be able to click that and you'll get the article here. If not, of course, just cut and paste and drop that in your browser. This particular article talks about leading companies that are looking at ways to connect with listening to their customers on an ongoing basis. So not your traditional annual patient satisfaction survey, but an ongoing way to listen to patients day in and day out. How are we doing? If there's things going well, tell us please. If there's not things going so well, let us know that too. So I emphasize all the time. So the process that you're going to see the data from today was an ongoing continuous process whereby every patient, the goal was 100% of the patients, would be asked, how did your visit go today? If there's something that went well, please tell us. If there's something that didn't go so well, we value your opinion. So the goal was survey or ask for feedback from 100% of the patients. I try not to use the word survey anymore. As soon as I do that, it invokes a paradigm, and people think about the survey that you might have experienced, the annual survey or the once-a-year survey or the survey report that you might have received, and your boss gives it to you, and they go, can we please fix wait time? This is like the 6th time in a row that we've had wait time on this report. So I try not to use the word survey because of that paradigm. So think about, can we help you? Can you connect with your patients to let them give you information back about their visit? And if they can give you information that's valuable, how do you use that to better manage the practice and affect change? So do it all the time. I pointed that out here in the circle. It's a little bit of a paradigm to think that way, but literally set your goal as 100% of your patients. This is how well this particular group did. This is a a subset of the overall organization. It's made up of about 570 or so practices, about 2,000 providers. And I separated it into size of practice just to show you that even the smallest of practices, they're inviting patients to give them feedback 125 times per month per provider. Larger groups, 10 or more providers, they're still asking patients to give them feedback 54 times per provider per month. So these are emails that were pushed to the patients proactively that said, would you please let us know if your visit went well? If it did, great. If not, your opinion's important to us. Click this link and let us know. Coach and counsel, that's the number 2 thing. So as you get feedback back from your patients, it'll be valuable information. Use that information. Don't let it go to waste. Use it soon after the visit. The sooner you can congratulate that front office staff for a job well done, the more likely they are to continue to repeat that behavior that got those great marks. Not too long ago, one of the practice managers said, Jerry, I'd love to do all this stuff you talk about, but we're so busy, I don't have time. Well, you think about it, if you can make time to congratulate staff for a job well done the day or two after the visit, or coach and counsel a staff member, perhaps that was, when I checked in, Jerry was rude to me. Well, take Jerry for a cup of coffee and coach and counsel. If you do that, you will affect change, and your plate will get less busy than it might have been otherwise. Do it in a timely fashion. As mentioned earlier, Jeff, in this particular process, we're asking patients the day after their visit to give feedback. That feedback comes back real time, and practice managers act on it as soon as possible as appropriate. When you do coach and counsel and give some of the feedback, use some of these basic techniques that you see here listed. Most of you know these probably as well or better than I do, but reinforce immediately. Be specific, so if you're congratulating somebody for a job well done, tell them specifically what they did if you know, or ask them what they did. Hey, when you checked in yesterday, Jeff said you made him feel warm like family. What went on with patient Rydburg yesterday when he checked in? Oh, all I did was congratulate him for, getting his award. And it's that kind of detail that your employees will remember and then repeat that behavior going forward. Reinforce often, of course. Use detail if you can. Be sincere, of course, and demonstrate respect. So this is some of the data that says, of those practices that ask patients to give feedback, how often did patients respond? About 20 patients responded per provider per month for the solo practices, and about 12 for the 2 to 3 provider group. So you can see the size of the practice, it diminishes a little bit. My point is, even in the larger practices, 7 patients per provider per month are providing real-time feedback. It doesn't take very long at all for that to add up to a significant number. So if you're doing continuous patient feedback and you're getting a 10 to 15 to 20% response rate, your goal is to survey 100% of your patients or ask your patients for feedback, you're going to get numbers that are statistically valid pretty quickly. Number 4, investigate, resolve service failures. Do it in a way that is appropriate. And I love this right here. All of us are human. We all make mistakes. We're probably all going to fail from time to time. So when we do something that it didn't go well, that's okay. It's how we respond to that failure that really matters. So if you have a patient that we didn't meet their expectations, that's okay. The follow-up is key. But if we blow the follow-up, oh my goodness, now we've really solidified what went wrong, and we don't want to do that, obviously. So when you got a chance to do some service recovery, do that and try to do it well, obviously. This is part of the process. Of those 570 practices, there was a requirement actually, to follow up with patients under certain conditions. Whenever those conditions are met, start the follow-up within 10 days and then have it resolved within 30. Of those 570 practices, 397 of them met the goal of following up with the patient 100% of the time, regardless of the size of the practice. So when asked, practice manager says, yeah, I can follow up with the patient, and they did, regardless of what that might have been. Sometimes it was the exam room was cold. Sometimes it was things that was perhaps more significant than that. My point is, Given the opportunity and the tools, folks can follow up with patients, and that makes a huge difference. As you see the diminishing line over here, all of these patients got followed up with, perhaps not within 30 days. So we're at 90% here, and as you go down, you can see the number diminish. My point is, folks are following up, and the process works well. We'll show you in a minute some results of the top box score, as a matter of fact, and how that top box score has improved over the 5 years that this organization has been using the 10 items that we're mentioning here. The follow-up piece is key. So we'll show you on the line graph, the trend line graph, when that follow-up began. Overcome opinion with objective data. A good friend of mine is an orthopedic surgeon. Marty Hudson and I met with him not too long ago, and I asked him, I said, David, I said, you guys probably need a patient satisfaction survey system, right? And he goes, no, all my patients are happy. I know they're happy. And that was his opinion, and he didn't have any factual data to back that up. He's a great man, and there's no doubt in my mind that a very high percentage of patients love David. Nevertheless, had he had the opportunity to have actual concrete data, he could have seen perhaps areas of opportunity for improvement within his practice and other areas that were going well that he could try to share those best practices. We did the same thing with the group that I'm talking about. We developed a one-page provider report. This one-page report allows a provider, believe it or not, you guys know this, providers still want to have the report, right? A piece of paper to see. So this is online, it's all real nice and fancy, it's analytic, you can log in, you can interact with it. That's okay, give me the report. They said, I want to see my report. Well, they didn't want to see a 34-page report. We had one of those. They wanted to see quick, easy, help me understand it, how am I doing? So we created this report. Jeff, his team, they said, hey, let's look at the recommend. Would I recommend this practice to family and friends? The graph on the top represents that question. The next 3 questions are the provider-patient encounter questions. Did the provider express concern for the patient? Did they explain the treatment? And was the exam thorough? Those 3, as Gary mentioned, have a very high correlation to overall patient loyalty. And we knew that intuitively years ago. We know it now scientifically. But when we developed this report, we said, let's let physicians see how they rank. This is the percentile ranking within the universe of our database for each of those 4 questions. This is their trend line. How you doing month in and month out, year over year. And then this is the benchmark comparison. This is the provider in green. There, whoops, let me go back. There, okay, hopefully I'm good there. Different peer groups here. These are subsets of doctors. This is their location, their clinic, the organization, and then this is their specialty across the country. This is our national database. So at a glance, they can compare to their peers, see how they're trending, see where they rank. We produce this for every provider at the end of the month, and their practice manager will typically go online, download this in a PDF format, print it out, and hand it to the doc to engage them. When you engage them, you know what happens next. They'll begin to ask questions about their data, and that's when we hand them the more comprehensive report if they'd like to see it. My point here is help them have this concrete data and not just have opinions about what might be working, but have concrete data. Nourish a culture of service excellence, an article here that you'll probably, if you haven't read it already, it would be something you'll probably want to read. Take care of your people and they'll take care of you. This is the link to download that. And everybody here knows the importance of nurturing a culture of service excellence. There's some good tips in this article. Talks about how employees invariably felt cared for, which they then in turn gave better customer service as a result. Act on the information. Action data is worthless without action. A nice excerpt here from How to Make the Most of Customer Feedback off of Inc. And it's how you act on the feedback that really makes the difference. So gathering the information is one thing. Then what do you do with that? How do you use that information to affect change? Brag on your employees. Most of your feedback will be positive. As I mentioned earlier, congratulate your employees right away. I'll share this one quick story with you. Marty and I were with a practice manager in Nashville, and I asked her, I said, look, do you use the flash report? That's a report that gives her real-time information about the patient's experience, and it gives it to her the day after the patient's visit. And so I said, do you get a chance to use the flash report to pass that along to your staff. And I didn't want to give her a predisposed notion of what I expected her to say, so I said, I know you're busy. Hey, if it takes you a day or two to get to it, that's okay. I just want to know if you use it. And she said, are you kidding me? She goes, as soon as I get the email alert that says something went well or something didn't go well, I look and see what happened, and if it's a good review, I print that off, I write a big thank you on the top, and I drop it in the employee's chair. Well, the employee's getting that thank you and that affirmation that things went well, usually the day after the visit or 2 days after the visit, soon after the occurrence is my point. And I said, you know what, I think you might be my hero. She said, hey, wait a minute. She goes, if I get a negative one, she goes, I print that off and I drop it in the doctor's inbox. I said, that's okay. I said, that's what you're doing. You're engaging the doctor, helping you affect change. So brag on your superstars. She does that. You'll see in a moment the results of the organization that I'm mentioning that have done that well. Last, listen, look, and learn. Those of you that are using and leveraging technology, you're already doing this to the extent that you can do it soon after the patient visit and do it as often as possible for as many patients as possible. You want to do that. Lastly, encourage and empower and expect excellence. Another article here that you're welcome to download. The link is here. And you got to love this one. Happy employees equal happy customers. So most of you know that. Most of you could probably write a book on that. This is a nice article that supports that, and wanted to share that with you. So the last slide here might be, in my opinion, probably one of the most important sets of data that I've seen around patient experience and patient feedback. And let me help you decipher this real quick. This is a 5-year trend going back to February of 2010. This organization began to collect patient feedback the day after the patient visit. 68% of patients said, I strongly agree that I would recommend my provider to a family member or a friend. 68%, pretty good top box number. Matter of fact, at the time, 68% was 6 points higher than our national average. So this group, this organization, this was about 1,500 doctors at that time. As an aggregate of 1,500 physicians and providers, they had a 68% top box. They began to embrace the idea of when you get patient feedback, use it to affect change. Most of the time, you're going to congratulate staff for a job well done. Occasionally, you'll coach and counsel. And when they did that, you can see what happened. Their top box kind of began to creep up a little bit. And by the end of the year, they were up here around 70, 71, 72, 73. So that was the end of the first year. We felt pretty good about that. And the next year rolled around, and lo and behold, we started out in January at 71%, dropped down a little bit. But for the most part, we sustained a pretty nice improvement performance there throughout the year. 2012 is in green. Again, we had some year-over-year improvement. We're feeling pretty good about that. We go. In the fall of 2012, this organization said, if a patient asked to be contacted, or if the patient left a comment and the comment was unfavorable, we would like for somebody to contact that patient or follow up on that survey appropriately. Sometimes the patients wanted to remain anonymous, so it wasn't appropriate to call the patient. That requirement, if the patient wants to be contacted and if they left a comment that was unfavorable, began the requirement follow-up process. So if that survey came through, the practice manager had 10 days to start their research, 30 days to get it resolved, and that compliance graph that I showed you earlier showed the vast majority of those practices complied with that standard 100% of the time. When they implemented the follow-up monitoring component of this process, you can see what happened to their top box score. It bumped up here in November, and we thought, oh, okay, hopefully that's not an episodic, hopefully that's not an aberration, hopefully that's not something that's going to go away, and it didn't. We sustained that top box performance into the next year. This is 2013, whoops, and then into 2014. And when we pulled this slide to submit to MGMA for the presentation, this organization was at 76.65% top box, which we were very glad to see. And then recently, Jeff, I pulled some new numbers for you. And right now, we've got 78% that we can plot on here for you for the month of September. And as of this morning, This organization that now represents about 3,000 doctors is at 77.04% top box. So you can see over the 5 years, they've gone from 68 to 77, quite a phenomenal improvement. And they did it by doing those 10 fairly simple action items that you saw just a moment ago, but they did it consistently day in and day out. So with that, I'm going to turn it back over to Mr. Jeff Rydburg, who helped lead most of this service improvement.
Thank you, Jerry. Yesterday morning, you heard the speaker talk about the value of being intentional, if you remember that, if you went to this. And our results, obviously, we're very pleased with them, but we believe it is because of the intentional approach we took. We could have said to all of our employees, all of our managers, patient satisfaction is important. Go out there and do a better job, right? Somebody will probably ask, so I'll answer it ahead of time. Well, Jeff, did you also, somewhere in that middle of that, did you change and start paying people for higher scores? And the answer is yes and no. We actually were paying people all along. So patient satisfaction has been part of the practice manager incentive plan all along. So that wasn't the change that made this happen. But as Jerry said, the intentional nature of it was, first we have to provide data. You've got to provide data that's easy for that practice manager to use. You've got to do it in a way that the doctor can see it, see the comments. Jerry didn't talk about the comments, but the comments are there for all the doctors to see, specifically related to them. We instituted the follow-up process that he talked about. So if a patient leaves some kind of comment, especially negative comments, then automatically that gets put into a database, and we track how fast our practice managers are contacting those patients. We have a standard, and we measure. Jerry showed the vast majority of our practices are able to get that done in 10 days, right? Most of you, if you spend any time thinking about patient satisfaction, you realize that if a patient's unhappy, if you can recover that within a quick period of time, it's almost as if it never happened. And in some cases, they're even more happy because they feel good that you took the time to resolve it. And so the point is, it's stuff that happens not by accident, but by intentionally saying, this is where we're going, this is what we're going to do, here's the tools we're putting in place to give you the information you need to help make this happen. That would be the wrong button. So we did want to thank a couple of other people, Jerry's partner, Marty Hudson, here in the front row, and the MedicalGPS staff for their help in putting the survey together. Dr. Garrison and his partner, Stan York from Belmont University. I couldn't do the coefficient R squared stuff that he was talking about. I just wanted to know what part of the visit drives loyalty. And they said they could figure that out for me. So we appreciate that for them. Leave you with one last thought before I leave a little bit of time for questions. If it wasn't 4 o'clock, I'd say close your eyes. But I'm not quite that stupid, right? All right, so here's what I think a normal kind of new patient visit might look like. So what I want you to do is think about what does it look like in your organization, and is that likely to create loyalty, okay? Or at least start you on the journey. I think this is what happens in a lot of organizations. Patient calls, wants to make an appointment. Probably put on hold for a minute or two, maybe transferred once or twice, but they finally get the right person and they say, it's Tuesday today, right? I want to make an appointment for Thursday. Okay, we have an appointment at 3 o'clock. Does that work? Yes, that'd be fine. Okay, great. I'll fill you in. And then maybe Wednesday, they get an automated call that says, this is an appointment reminder for Thursday at 3 o'clock. And then the patient comes in, and they come to the front desk, and the front desk person hands them a stack of papers, oftentimes with a clipboard, thank goodness, right, and a pen. Say, oh, I see you're new. Can you fill this out for us, please? Right, courteous, okay? Patient fills all that stuff out, hands it back, goes through the normal visit, doctor's pleasant, okay? And then they go home, okay? I think that's what happens most of the time. Contrast that with what I think we should be doing, especially with new patients. Patient doesn't call. Patient actually goes online, because that's how everybody finds you now. When was the last time anybody used the yellow pages, right? Anybody in this decade? No, they go online. So the patient actually doesn't call. They go online and schedule an appointment with our organization online. They click the button that says, book appointment now, right? So they schedule that appointment on Tuesday. On Wednesday, they get a call from the practice manager. Says, Mr. Smith, I see that you booked an appointment online. I see that you're a new patient to the organization. We're very excited about having you with us. If you go online, you'll find some paperwork that we need to have as a new patient. We'd love for you to fill that out before you come in. It'll save you time if you do all that stuff ahead of time. We look forward to seeing you tomorrow. Thursday comes, patient shows up. Front desk person now doesn't throw a clipboard at them, but instead says, oh, Mr. Smith, we've been waiting for you. I see you're a new patient with us. Thank you for trusting us with your care today. I see you have your paperwork done. Have a seat. We'll be right with you. Nurse takes patient back, puts in the exam room, takes vitals and that kind of thing. Says, oh, Mr. Smith, I see you're a new patient with us. We sure appreciate you trusting us with your care today. Doctor comes in, does the visit, patient goes home. When the patient goes back to work, because it's 3 o'clock, right? We get that patient out fast, so that patient still has time to go back to work. Patient goes back to work. When they get home, there's a voicemail waiting for them that says, this is ABC practice. We just wanted to let you know that we appreciate you coming in today and wanted to have you call us if you had any questions about your care. Friday, patient gets a call from the practice manager. Mr. Smith, so glad that you came in yesterday. Just wanted to make sure that you got your medications okay, if there was medications involved, that everything went okay with the visit, and I want you to know, please call me if there's anything that we could do better. Okay? So tell me, which of those two scenarios is most likely to start the loyalty journey? Number 1 or number 2? Number 2. If we all believe it's number 2, how many of us are doing number 2? Almost none of us, okay? Now, somebody's going to say, well, but Jeff, we're busy, okay? Do y'all track how many new patients per month you get? Some yes, some no, okay? The average practice, the average primary care practice, it's about 6 to 8%, okay? Obviously, if you're brand new, it'll be bigger. If you've got a full practice, it'll be smaller. Specialists are a little bit higher. For our 3,000 doctors across many, many specialties, the average is about 10%, okay? If you're in a practice with 3 doctors, seeing 20 patients a day, that means you got to call 6. 10% of 60, right? 6 patients a day. That's all we're asking for you to change the culture, change the reputation of your organization, and start developing advocacy, loyalty amongst your patients. Okay? Thank you for listening. With that, we have a few minutes for questions if anybody has any. Any questions? Yes, ma'am.
Did you find consistent components of loyalty in both primary and specialty care practices?
The question was there any difference between primary care practices and specialty care practices in terms of the components? I think the answer is no, Jerry, unless you remember something. It was still the physician's activity, that drove it.
Okay.
Okay? Any other questions? Yes, sir. Mm-hmm. Right. Uh-huh. Yeah, honestly, that's so long. The question was, is there a specific reason why 2010 finished up here in the purple and 2011 started down there down there. Not that, frankly, it was too long ago, honestly, for me to remember. I don't think it was that there was anything. Because we add practices all the time, it could be that we added a bunch of practices in that January and they hadn't kind of gotten used to our structure, our system. Okay? Seeing no other questions, again, thank you for your time. Have a good time the rest of the conference.